So this is an OB ultrasound. Your clips are perfect. I do not see a clear IUP. The reason for making this video is just to go over measuring the gestational sac here, which you did, but also to go over some of your other options here. In the ER, I try to teach that the gestational sac measurement is something that we shouldn't be doing. Now, for those in family medicine and who do more OB, it's more of an appropriate study. But your goal here is to see how far along the development is. When a patient comes in to the emergency room, we really want to know, is there an intrauterine pregnancy or not? And once we see an IUP, I think then it's reasonable to then measure the crown rump length to then tell the patient how far along they are. Here, you only see a gestational sac that's this big, and so you falsely measured this patient to be farther along than she really is. Again, I think measuring the gestational sac could be falsely reassuring because you could measure a gestational sac that would illustrate a patient to be 6 weeks. But if you don't see an intrauterine pregnancy, then that's concerning and something where I would want at least my providers to be more cautious about and to explore further. So the main take-home point when doing gestational sac measurements, first off, you're really overestimating here. The gestational sac is just this little thing right here. And then from emergency medicine perspective, which could be different for certain providers such as family medicine and other specialties, I really don't think the gestational sac measurement is of use to us. Rather, I prefer using crown rump length. When you have patients in the second trimester doing the doing the BPD or femur length is preferred, and that's what I would measure if in the second trimester. So hope this video helps. Let me know if you have any questions. Thanks for saving.